The number of flu cases in the area is increasing, but doctors say it's a slow start. They say compared to last year, the virus is similar, therefore getting the flu shot will make a big difference. Our Chandler Walsh joins us live now with more. Chandler.
Brittany, it's not too late to get the flu shot. UMass Memorial Medical Center recommends getting it before Thanksgiving, and they say though it's not 100% effective, it will decrease symptoms and chances of being hospitalized. UMass Memorial Medical Center has seen a handful of flu cases so far this season.
1 week where we had 3 patients, but then we haven't seen anything since that.
Dr. Richard Ellison works in the infectious diseases department and says now is the time to get vaccinated.
You want to get it about 2 weeks before the beginning of the season to give the chance for your body to begin to develop antibodies in relation to getting the flu shot.
Ellison says the flu season typically picks up mid-December. According to the CDC, there were more than 200,000 positive cases in the United States last season, and Ellison says so far this year seems similar. He recommends getting a flu vaccine each year.
The flu virus changes a little bit every year, and to sort of keep up with the changes with the virus, we need to go and have to make minor adjustments.
For school children, Ellison says there's a greater chance of sharing viruses. Christian Uraka says it's important he teach his 2 kids how to prevent germs from spreading.
When they get home, definitely make sure they wash their hands and teach them that when they go out, grocery shopping or wherever normally would go, sporting event, make sure to wash their hands all the time.
And for kids who aren't fans of shots,
I don't like it when they put the needle.
Nasal spray vaccines are back and offer another form of protection. Ellison says these vaccines haven't been recommended the past 2 seasons, but are now more effective.
They couldn't get a good match, and what they're developing was a virus which really didn't grow very well in the nose, so it didn't give protection. So they replaced the one part of that vaccine.
Now, an interesting fact, this fall marks 100 years since the flu season of 1918. Ellison says it was the worst pandemic in history, killing more than 20 million people. Now, of course, there were no antibiotics or intensive care units back then, but it's still one reason people always talk about the flu. Chandler Walsh, Worcester News Tonight.